Hello, this is Dr. Farhangfar. I hope that you're doing well. And I want to welcome you to the shift, the 12-week Mediterranean weight loss plan. I want to congratulate you for showing up and participating because oftentimes I see that people want to lose weight, they want to get healthy and fit. They start with good intentions, but after a while they get tired and they face obstacles. They revert back to their old ways of doing things. They get discouraged and they do not follow through with their plans. And that's when things are not going to work very well for them. And this is what we want to prevent, and I'm glad that you're here, that you're participating, and with consistent and applying your knowledge, you will achieve your weight loss goals. Many people have done it, and you will be able to do the same. So with that in mind, let's go ahead and get started with week 4 presentation. Again, the usual disclaimers. The information that is presented today is for educational purposes only. Please consult your own medical provider to customize any weight loss plan for your particular situation. Also, if you are to start a new exercise program, please consult with your medical provider. You want to make sure that you're physically able to handle the stresses of a new weight loss program. So with that in mind, let's go ahead and get started with the presentation for today. Today we're going to be discussing a very important topic for weight loss. We are going to talk about exercise and how we can combine that with our good diet to be able to achieve our weight loss goals. So today we will be discussing health benefits of regular exercise. We will be discussing specifically the role of exercise in regard to weight loss and maintenance. And we will also be talking about guidelines for physical activity and exercise. We will also be talking about strategies to maintain motivation and overcoming challenges, because believe me, as soon as you plan to start a new exercise routine, you will face obstacles, you will face challenges. The key is to persist and also continue with your weight loss program to get help and to be able to overcome those obstacles. So with that in mind, let's go ahead and talk about some of the benefits of regular exercise program. There are numerous weight loss and health benefits from regular exercise program, including cardiovascular and metabolic health, cognitive and mental performance, reduce risk of cancers, enhance daily functions and being independent, maintaining bone health, and also sleep improvement. Remember, sleep is very important when you are trying to lose weight. You want to make sure that you're getting adequate amount of sleep, 7 to 8 hours a day at the minimum. So cardiovascular and metabolic health, regular exercise lowers the risk of cardiovascular disease, type 2 diabetes, stroke, and hypertension. These are all major problems that we're facing in our modern day, and these are very responsive to lifestyle changes, including regular exercise program. Exercise acts therapeutically for heart conditions such as heart failure and coronary artery disease and hypertension. By maintaining regular physical activity, oftentimes you can lower your cholesterol level, you can lower your blood pressure, and the benefits are very much there for getting involved with a regular exercise program. So I highly encourage you to do that. As far as the mental health aspect, we know that exercise is probably the most effective way to deal with the stress. Also helps with improved cognition, memory, attention, decision making, especially as people get older. Regular exercise become much more important in maintaining good health. We know that regular exercise can reduce some form of cancers, risk of cancer treatment, chemotherapy is also reduced for patients that are involved with regular exercise program. Also enhance daily function and independence, increasing strength and endurance enables performance of daily activities and maintaining independence as people get older. Remember, as we get older, our muscle mass decreases. The phenomenon of sarcopenia, we lose muscle mass as we get older, and maintaining a regular exercise program will go a long way to prevent that. Also, regular exercise is important for bone health. It supports strong bones and muscles, improves balance, and reduces joint stiffness. Also helps with sleep, promotes better sleep by reducing anxiety and lowering arousal, aiding faster sleep onset. The benefits are virtually limitless. I can go on and on about the benefits of regular exercise. It is very important to get into habit of regular exercise. Now, when I say regular exercise, I do not mean to be on a treadmill for 2 hours a day. Any kind of activity will be helpful as far as exercise is concerned. Even things like gardening, household chores, walking, all of these are considered to be examples of increased physical activity. So let's talk about the role of exercise in weight loss and maintenance. Exercise is crucial for weight loss, not only for losing weight, but also for maintaining weight loss. Physical activity burns excess calories, preventing fat storage, aiding weight maintenance. This is very important because a lot of people lose weight, however, they are not able to maintain that for long periods of time. And it's important to combine a proper diet with a regular exercise program for optimal results. Combining exercise with healthy low-calorie diet enhances weight loss success, both for short-term and for long-term. Recommended activity level for weight loss. Long-term weight loss maintenance requires at least 300 minutes of moderate intensity exercise per week. That would be 1 hour of exercise 5 times a week. When combined together, again, low-calorie diet and moderate exercise activity levels will provide the best chances for weight loss and long-term maintenance. Regular physical activity is crucial to avoid regaining the lost weight. So once you are able to lose the weight, then you want to be able to maintain that, and exercise will do that for you. Now let's talk about the physical activity guidelines and exercise types. We're going to be talking about cardiovascular and strength training. We're going to be talking about recommended exercise duration and intensity, And also we're going to be talking about different options that are available as far as your exercise routine is concerned. So cardiovascular exercise improves your heart rate, circulation, bone intensity, bone density, and reduces stress. Strength training builds lean muscle mass, boosts your metabolism, strengthens your bones, and improves your daily functional abilities. Combining cardio and strength training yields optimal weight loss results. So ideally you want to be doing both cardio and strength training for best results. So let's talk about that and break it down so we know what we're talking about. So strength training, also known as resistance or weight training, is any type of exercise that causes your muscles to contract against an external resistance. This could include weights, resistance band, body weight, or even heavy objects. And we want to build our muscle, we want to maintain our muscles. As we get older, this becomes a huge problem for older adults when they lose their muscle mass. Also, muscle is active metabolizing tissue, it's burning calories, so the more muscle that we have, the more effective our metabolism will be. It's essential strength training for overall health and functional well-being. And again, combining the cardio and strength training will yield optimal weight loss benefits. So their recommendations are that healthy adults should perform at least 150 minutes of moderate aerobic exercise weekly, plus strength training at least twice weekly. This is just the bare minimum to be able to maintain your health. Now let's talk about moderate intensity exercise, moderate exercise level. This is referring to physical activity that raises your heart rate and breathing, but still allows you to carry on a regular conversation without gasping for air. It is a middle ground between light movement and high intensity training, challenging enough to benefit your heart and lungs, but sustainable for longer durations. So heart rate, we want to get our heart rate 70 to 80% of your maximum heart rate. So the way you calculate your maximum heart rate is you take 220 minus your age, and that becomes your maximum heart rate. So let's say if you're 35 years old, your maximum heart rate is 185 beats per minute. So in order to get into a cardiac zone for fat burning, you want to get at least to 60% of your maximum heart rate, which in this case would be 111 beats per minute for that 35-year-old trying to lose weight. And also we want to, at the bare minimum, to be able to maintain this 111 beats per minute for 30 minutes. This is when we get into fat burning zone, and this is when we start burning fat. So examples of moderate intensity activities include brisk walking, about 3 to 5 miles per hour pace, casual biking on a flat terrain, steady pace, even light yard work, raking leaves, gardening, pushing a mower, dancing, social or recreational style dancing is excellent form of moderate intensity exercise, water aerobic, and recreational sports such as tennis and easy pace basketball. These are all considered to be moderate levels of activity. Now, vigorous activities such as running and swimming involves heavy breathing, which make regular conversation more difficult. So if you're trying to decide if you're doing moderate intensity exercise or you're doing vigorous activity, you have to take the talk test. If you're able to talk normally without gasping for air, you're exercising at low to moderate levels of intensity. If you're barely able to keep up and you're not able to converse, then that means that you are in vigorous activity zone. Vigorous activity significantly elevates your heart rate, breathing, and perceived exertion levels, often pushing you to close to the maximum effort. With vigorous activity, typically you get up to 70 to 90% of your maximum heart rate. Again, to calculate your maximum heart rate, you want to take number 220 minus your age. That will give you approximately the beats per minute of your maximum heart rate. So examples of these include jumping ropes, stair climbing, cycling sprints, rowing machine intervals. These are all examples of vigorous physical activity. So these are all important to keep in mind for when you decide what kind of a program to get involved with. Again, if you have not been exercising for a while, you would definitely need to speak with a physical therapist or your medical provider. Make sure that you get medical clearance. Make sure you get exercises that are suitable for you. Don't jump into doing exercise program if you're not used to it, especially if you are having any cardiovascular disease and or other medical issues. Definitely want to get this checked. So combining approaches for optimal results, strength training, we talked about this, building your muscle mass, your metabolism, help maintain your bone density. Also with the mental aspect of regular exercise, stress reduction, and also doing aerobic exercise, cardiovascular, and combining that with a low density, high protein, Mediterranean style diet. That is when magic starts happening. That's when you start losing weight. So types of exercise that we're talking about, these are accessible exercise options such as walking in low impact, and even if you're not used to walking, getting out and doing 5 minutes of walking will help you. As you get more proficient, as your body is able to get used to higher levels of activity, your goal is 30 to 60 minutes of exercise every day, of walking. That would be wonderful. Other activities such as cycling is very gentle on your joints, also enhances your cardiovascular health. Strength training can be done at home with body weight exercises, household items like cans of food or a bottle of milk. Stair climbing, burpees, squats, high intensity interval trainings are more advanced forms of exercise, and you will need to make sure that you have some experience exercising and maybe get some guidance and also get some help to be able to get the most benefit without causing damage to your body. Okay, so a lot of times people want to exercise, they start on a regular exercise program, but soon afterward they lose motivation. So that is when your habits come in. If you are relying on motivation alone, then there are days that you do not feel like exercising. And if you go with how you feel, then you will most likely skip your exercise. This is not a good thing. So we want to have good habits that are going to support our weight loss efforts. So developing enjoyable and sustainable habits, finding the exercises that you like to do, what is available to you, what resources you have. Do you have a park? Do you have a gym membership? Do you have a swimming pool? Do you have some weights at home? Whatever you have, you need to start from there. Starting with small, manageable activities will prevent burnout and builds your confidence. So use whatever you have where you are. Start today, get help, get direction, get going. Setting goals and monitoring your progress. It's important to set realistic goals, focusing on activity frequency rather than immediate weight loss. So when you start your weight loss program, you may or may not see results right away. We have to think long term. We're exercising for our health. We're not exercising to necessarily lose a bunch of weight. We want to be able to maintain our health, and exercise is an excellent way to do that. So you want to track your progress through diaries, writing things down, and celebrating your achievement is very important to keep you motivated and keep you on track. You have to be flexible, and you also have to have a good support system. Some days, because of injuries or because of other things that are happening in your life, you may not be able to get out and do your exercise. You need to be adaptable to life's disruptions to prevent discouragement, and you should have alternative activities that you can do when your regular activities are not available to you. And if you miss a day, do not beat yourself up. Just get back on track and start getting on your exercise routine. It is better if you're exercising with friends or groups, and also if you have a professional physical therapist or personal trainers that can help you, keep you accountable, and make sure that you're performing the exercises correctly and you're not causing damage to yourself. Also, managing setbacks and triggers, identifying causes of setbacks such as stress or emotional eating helps develop coping strategies. Building resilience against obstacles, encourage sustained physical activity. This will build your self-confidence, and as you get better at this, then you know that this is something that you can do. So, key takeaways from our talk today: consistent physical activity is essential for effective weight management, physical health, and mental well-being. In combination with healthy eating, mindful practices, stress management, proper sleep, maximizes the benefits of weight loss. Also, you need to tailor your exercises based on your level of activity, your personal preferences, and seeking professional guidance to ensure that your exercise is going to be sustainable and will give you the results that you want to keep going with your exercise program. So this is very important to keep in mind. Again, thank you for being here, and I enjoyed providing this information for you. Please sign up for our weight loss Mediterranean 12 weeks program and get the handouts. If you have any questions or comments, please write them below. And with that, thank you very much. Until next week. Bye-bye.